Also new tonight, for the first time in years, a strategic plan to deal with the North Shore's mental health crisis is taking shape, sparked by two major events. One, an 8-month study to identify gaps and goals in the system, and the second, an election of a new coroner in St. Tammany Parish. North Shore reporter Heath Allen tells us tonight that innovative plans are on the table to tackle the mental health crisis.
We're going to have to do something different, and I think you're going to see that begin to unfold over the next several months.
Within days of his election as St. Tammany Parish coroner, Dr. Charles Preston had already seen 2 suicides, evidence of the ongoing mental health crisis on the North Shore. He has already made the mental health director's position in his office full-time, nights, weekends, holidays, to meet the problem head-on.
The coroner's office is just one small cog in that wheel of success, and that wheel has already been created.
He is all in. He knows that part of his mission is mental health.
The drastic changes at Southeast Louisiana Hospital in Mandeville only added fuel to the fire. St. Tammany launched an intensive 8-month study by the Louisiana Public Health Institute, which is now just wrapping up, identifying what can actually be done to deal with the mental health dilemma.
They've broken down really what we have, what we need, and put it down on paper, and we've put some pretty strong goals and some objectives down.
We want to get to the people that are in trouble before they really get to a crisis point.
One goal very likely to happen, a much smaller facility with enough beds to deal with both major and minor emergencies.
Access somewhere other than hospitals and law enforcement agencies, care given in places other than hospitals, and those beds being used more appropriately.
Sometimes they just need, they need to be around mental health professionals for maybe a day or two just to get stabilized. An emergency room is not always the best place, and certainly a jail cell is not always the best place.
That idea, one of many, ranging from training to treatment, using available resources, taking pressure off law enforcement who've been handling more mental health calls than traffic issues.
Strategies in place, and we have a goal.
Brister says having the coroner on board is huge, and with the Louisiana Public Health Institute study, the path, she says, is clear now to deal with the crisis. On your side on the North Shore, Heath Allen, WDSU News.
The Louisiana Public Health Institute study examining the mental health crisis in St. Tammany was funded by Baptist Community Ministries and the North Shore Community Foundation.